Hello, this is Dr. Janani Saravanan, gynecologist working at Narayna Multispeciality Hospital, HSR layout. Now let's discuss a few things about one of the routinely performed tests in women's health care. That's the pap smear test. Pap smear is actually a screening test for cervical cancer. Cervix is the lower part of the uterus or the womb which opens into the topmost part of the vagina. So why screen for cervical cancer? It's because cervical cancer is quite common in India and it is one of the leading causes of deaths in women in our country. So this cancer is usually caused by a virus called as the human papilloma virus, which a woman acquires through sexual contact in her reproductive years. So the cancer doesn't happen all of a sudden. It takes a few years from the acquisition of infection to the final development of cancer. So hence we have a lot of time in between to screen the woman and pick up the changes, if any, at the right time. So there can be some cellular changes and then precancerous stage and finally cancer over a period of time of, like I said, like around 10 years or so. The other thing is the cervix is easily accessible through the vagina, like in a routine gynec examination. So how do we do it? The woman lies on the examining couch on her back with the knees bent, and then we insert an instrument called as the speculum. The pap smear test may cause a little discomfort, but it's not painful and it's a simple thing that's done in the OPD. Once we insert the speculum and we visualize the cervix well, then we insert a wooden stick kind of a thing called as the wire spatula or a brush that's called as a scraper, and then we take a few cells from the cervix. And then the specimen that is collected is sent to the lab where the cells are smeared and seen under a microscope. Then we get to know the results. So based on the result, it can be a normal smear where the cells are normal and then which implies the cervix is absolutely healthy, or it can be an abnormal smear. The abnormalities can range from just cellular changes or a precancerous state or frank cancer. So accordingly, your gynecologist will guide you further, like we may ask for certain tests like HPV testing or go for a test called as a colposcopy, wherein the cervix is visualized under magnification and then a biopsy can be taken. So when to screen a woman? Women can be screened for cervical cancer starting from the age of 21 years if they are sexually active, or after 3 years of vaginal sex, whichever is earlier. And then pap smear is supposed to be taken every 3 years until the age of 65 years. At 65, one can stop the screening if previous pap smears for the past 10 years were normal. So there is something called as the false negative. So a test that can say normal, but then actually it can harbor some kind of problems in the cervix. So that's the reason we need to screen it every 3 years. Hence, to summarize, cervical cancer is very much preventable and curable if picked up in the right time. So get screened and stay healthy.